Hello, 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 once again, USA. This is Fire a Bug Live. I'm your host, Chaplain Eric Coe. We've been talking about post-traumatic stress disorder, also known as PTSD. In a moment, we're going to get into part 2 of our segment, Signs and Symptoms and Possible Treatments. But first, let's take a recap of what we talked about in our part 1 segment. To start off, obviously, we, as public safety members, we all took an oath. And it's in the book of John in our Bible. It's John 15:13. It states, "No one has greater love than this, than someone would lay down his life for his friends." Obviously, we're doing this to serve people. And, sometimes things happen. We see some pretty nasty things out there. And, we talked about what it is, called post-traumatic stress disorder. We talked about, what is it about? How do you get it? It talked about the history of it, that they can relate PTSD possibly all the way back as far as the Civil War. It used to be called shell shock, battle fatigue syndrome. Currently it's PTSD. And basically it's defined as a mental health condition caused by a traumatic event or events such as sexual assault, serious injury, loss of a fellow coworker, loss of a child, loss of a patient or a loved one, natural disasters, the threat of death even, or witnessing a traumatic event or situation. We also looked back at, that they're looking at some genes possibly that can link PTSD to some people. The COMT gene and the TPH-2 gene. We talked about when your normal response to trauma becomes PTSD when you become stuck. Because most people, after they see a traumatic event, the mind and body are in shock. But after you make sense of what happens, it processes your emotions, and you come out of it. And obviously, with PTSD, you just remain in psychological shock. So we talked about that, and we also talked about how the physical aspect of the brain changes, how the amygdala expands and gets bigger. Actually, one thing I didn't add in there, that the frontal cortex actually starts shrinking a little bit. So that was one of the other ones that we have just recently found out about. And lastly, on our recap, we talked about anywhere from 7% to 37% of firefighters meet the criteria for current diagnosis of PTSD. And we looked at that as many factors, if they're paid or volunteer, if it was a questionnaire, if they were interviewed in person, and other factors. So now, let's get into our second part of our discussion, or mini-series on PTSD, signs and symptoms. There's some scripture to this that I'd like to share with you all. States in the book of Daniel 3:17 states, "If the God we serve exists, then he can rescue us from the furnace of blazing fire, and he can rescue us from the power of you, the king." Let's get into this sign and symptoms ordeal. We all know people with PTSD relive the events or event through thoughts and memory. They could be flashbacks, hallucinations, and nightmares. They may feel a great deal of distress when certain things remind them of the trauma, such as an anniversary of the date of the event. People with PTSD have avoidance of places, thoughts, and people that may remind them of the traumatic events, like the firehouse or the hospital, certain buildings, certain scenes. They may feel detachment and have isolation from families and friends. They'll lose interest in activities that they used to enjoy. They may have increased arousal, excessive emotions, problems relating to others, including their feelings or showing affection, difficulty falling or staying asleep, irritability, outbursts of anger. That's a pretty popular one for people with PTSD. Difficulty concentrating and being jumpy or easily startled. Example of that would be, your little 5-year-old comes running across the house and he comes up behind you and goes boo, and you're startled by it more than you normally would be. That could be a possibility of a sign and symptom. You may suffer some physical symptoms such as increased blood pressure and heart rate, rapid breathing, muscle tension, nausea, and diarrhea. It really affects the whole body because it's a stressor, and we know, if some of you may know that stress is like a cancer. It eats you from the inside out. Feeling alienated and alone. Hypervigilance is a big one, always on red alert. You sit with your back against the wall where you can see doors and windows. You never sit away from the walls. You may have guilt, shame, self-blame. Another popular one that we're trying to prevent is substance abuse, whether it's illegal or prescription drug use, and alcoholism. That's a big one. Feelings of mistrust, betrayal, depression, hopelessness, suicidal thoughts and feelings. This is very big. This is very important. This is something that myself is taking personal responsibility for, that I want to knock down the numbers. Never going to stop it, but if we can knock down the numbers, it's going to be wonderful. Suicidal thoughts and feelings. Currently, up to date, right now, as of today, 2015, we've lost 82 firefighters nationwide to suicide. Currently, last year in 2014, the newest figures came in, and we lost 106 firefighters. 2013, 68 took their lives, and in 2012, we lost 70. These statistics actually come from Captain Jeff Dill with Firefighter Behavioral Health Alliance. He keeps track of all this nationwide, and I believe in Canada and some international as well. But, he gets all these reports, or supposed to get these reports, whenever there is a suicide in the fire industry. As far as police officers are concerned, so far we're looking at 1 in every 500 police officers are committing suicide as we speak. Again, this is my personal mission to knock this off. This has got to stop. We as brothers and sisters need to get in each other's faces. We need to support each other and stop with, you're weak if you feel this or feel that. So, eventually we're gonna knock these numbers down with the help of others out there, and the foundation that I'm wanting to move forward with to prevent that, to help those who don't have insurance and to help those who can't pay for therapy get the therapy. Then we've done our job. So those are some of the signs and symptoms that people with PTSD present. They may present a lot of these, and they may just present a few. But if you notice somebody of this, or if you're one of these type of people who are presenting these type of signs and symptoms, please go get some help right away. Get in there, get tested. It may be a false alarm, but it may not either. So please go get yourself checked out for that. Now let's move into possible treatments. And these there's so many out there right now. What works for one may not work for another. Or it may. Even though PTSD doesn't have a cure yet, there are ways to cope and deal with it. And some of the ways are, first and foremost, go to your God. Praying. Give it to God. Ask for daily strength to get through the day. It's tough. Very tough. Going through PTSD. It's tough for the families as well. The wives, the girlfriends, the husbands, the boyfriends, moms and dads, brothers and sisters out there. It's very tough for everybody to go through. You can go get social support, talking to trusted family members and friends, church members, or other community resources. You can cope with your symptoms in a positive and adaptive ways, like exercise, healthy nutrition, connecting to others, not negative. So people who are so positive out there, it kind of makes you sick. See if you can connect with those type of people. They'll definitely lift you up like you need to be lifted. People who don't drink or do drugs or overeat or isolate themselves, stay away from those guys. Stay away from them. Get away from stress of the event. Get away from the stress of that event. Turn off your TV, news reports, and distract yourself by doing something you enjoy. I know I said back in the signs and symptoms, a lot of people with PTSD get away from the things they used to enjoy. Try to force yourself. I know it's hard. I know from experience it's extremely difficult, but you got to get off your butt and try it. Get back to your everyday routines again. As I said prior to the signs and symptoms, you don't want to do that. But they do say, your familiar habits can be comforting. Take time to grieve and cry if you need to feel better in the long run. You need to let those feelings out instead of pushing them away or hiding them. There's psychotherapy. There's a form of psychotherapy called somatic experiencing and sensor motor psychotherapy. There's cognitive behavioral therapy, such as exposure therapy, stress inoculation training, cognitive therapy, and eye movement. Cognitive therapy, and then there's also eye movement desensitization and reprocessing, which is also known as EMDR. That one's become popular. It does work well for some people, others it doesn't. You can go to your doctor, go to a licensed professional who's allowed to give out medication, who knows about PTSD. Right now, the U.S. FDA has approved Zoloft and Paxil as a form of treatment of PTSD. So definitely go to your doctor, talk about it, and see what they think. There's another one called dialectical behavioral therapy, also known as DBT. The FDA has approved this form of reducing pain, insomnia, anxiety, depression, and stress called Alpha STEM. Another big thing that's going on out there right now, a service dog. I'm getting mine next week. I'm excited. It's been long overdue. I hear that these service dogs, they prevent you from having an episode or knocking down your crisis to a minimum before you even know you're going to have a crisis. Can you imagine that? 10 minutes or 5 minutes before you even know you're going to have a crisis, your service dog comes up to you, nudges you, puts his paw on your face or a paw on his hand. How cool is that? I mean, that's amazing. So, we're going to conclude tonight's podcast of part 2 with signs and symptoms and possible treatments. Everybody, love one another. Get in each other's faces. Help each other out in this. We have to stop the suicides. It's getting out of control. Talk to your healthcare provider. Go to your therapist. Swallow your pride. That's the big one. Swallow your pride. Go get the help you need. If you want more information on this, you can go to my website, www.emergencythoughts.org. If you're wanting to donate to the foundation, also known as Operation PTSD Rescue, where we will help first responders get therapy paid for if their insurance doesn't cover mental health therapy or they no longer have insurance. We like to get them in the doors to somebody to get them started in the therapy, and then hopefully their local area will give them the resources they need to continue that therapy. So again, you can go to www.emergencythoughts.org, or you can go to operationptsdrescue.org. Until next time, fade to black.